Hi, and welcome to our SPCE 619 Section 810 debate. We will be debating teletherapy ABA versus in-home ABA therapy. Our group members include myself, Annie, Victoria, Laura, Janine, and Tina. For this debate, I will be the moderator. Laura and Janine will be supporting teletherapy, and Victoria and Tina will be supporting in-home therapy. First, I'd like to get started by explaining the two types of therapy. What is teletherapy? Tele-ABA, also known in the field as teletherapy and telebehavioral health, involves the use of advanced technologies to enable individuals to receive professional services from a distance. This can include live video streaming on software like FaceTime or Google Hangouts, or interacting online through multimedia platforms such as pre-recorded videos, modules, or chat rooms. Sessions are essentially conducted in the same as in-home, except the client and therapist interact through video or another multimedia platform. What is in-home therapy? In-home therapy is when the therapist goes into the home and works with the client and family to practice skills utilized inside and outside of the client's home. Sessions can include hands-on lessons for the family to practice skills, or sessions could be one-on-one with client therapists teaching and practicing the skills. Teletherapy versus in-home therapy. These types of therapies essentially have the same model and purpose. One is in person at a home, and the other is practiced over a form of media or technology. Both types of therapy are driven by data and have the purpose to bring about positive, meaningful change in behavior. Both types also develop an individualized program to each client. So without further ado, here's our debate, starting with teletherapy.
Teletherapy has many advantages and is becoming widely accepted in the ABA field as an alternative to in-home ABA therapy. Some of the main benefits of teletherapy are that it's convenient for clients and ABA providers, it's cost and time effective, the technology is basic and inexpensive and can be accessed at any time at any location, and it can be shared across settings and people. Teletherapy eliminates the need for on-site ABA services, which eliminates the costs associated with travel time for the therapist and reduces assessment costs for clients. A review by Tomlinson, Gore, and McGill found that telehealth training was highly socially valid and resulted in significant financial savings for organizations and reduced travel time burdens for trainees. A study by Wacker et al. Found that costs of delivering functional analysis via a telehealth delivery model were significantly lower than if services had been delivered in the participants' homes. The average weekly cost of delivering FAs via telehealth was $57.95 per participant, whereas if these services were delivered in the participants' homes, the average weekly cost would have been $335.09. The results of this study also found that the capacity to identify functions of behavior were comparable to direct service delivery of FAs in clients' homes. A lack of access to ABA services to families living in rural areas present a challenge and often result in long delays of receiving services. Many times, families have to pay expensive fees to obtain out-of-state providers, or children go without the services they need. The use of telehealth services is a solution to this problem, and behavior analysts can conduct functional analysis to reduce problem behavior and provide behavior analytic services. Teletherapy has the ability to serve a wider client community, can be conducted in multiple settings, and provide services to those in geographically distant areas who otherwise might not be able to receive services. Another advantage to using teletherapy is that technology is easily accessible, with the only requirements being a smartphone, tablet, or computer and high-speed internet. Telehealth services enable families and individuals to receive ABA services at a distance, either through live video conferencing or interacting through online multimedia platforms. This technology consists of basic, inexpensive equipment, which can be accessed at any time of day and in any location, which also makes scheduling sessions and appointments easier for families and therapists. Preliminary findings of a telehealth approach to parent training by Vismera et al. Found that a telehealth intervention program was an easy platform to navigate and access the features. All of the parents found that information was relevant and useful to their learning needs. Parents also reported to feel confident in their intervention skills, to improve their child's social communication skills, along with helping other caretakers to do the same. Additionally, teletherapy can increase family and parent participation in interventions with their child. Vismera et al. Found that intervention strategies can be taught to parents in a short period of time using remote training and changes in children's functional communication skills related to parents' intervention use and engagement, resulting in greater language growth in their child. A primary ethical advantage to using a teletherapy approach is that it minimizes the potential for multiple relationships to form between the professional and client. Because the therapist or behavior analyst is not working with the client on a regular basis in their home, it is less likely that ABA professionals will encounter situations where clients attempt to offer gifts, seek outside services, or view the behavior analyst or therapist as anything more than a professional behavior analytic provider. Confidentiality breaches through teletherapy services can be avoided through use of anti-spyware and antivirus software. Coded personal information and encryption of data transfer signals help to protect confidentiality records and data. An important ethical and legal consideration is that telehealth does adhere to HIPAA laws. Telehealth platforms provide HIPAA-compliant software programs that meet federal government standards. These software programs contain encryption features for safety and privacy and provide secure network connections to protect private and personal information. HIPAA-compliant software is an absolute must for providing teletherapy services to ensure personal health information is protected and secure. Teletherapy also follows Compliance Code 2.09, treatment and intervention efficiency. Telehealth models incorporate the best available communications technology that provide the same individualized and evidence-based treatments that are delivered at home. Teletherapy, or tele-ABA, also allows for ongoing supervision and feedback to the therapist or parent implementing the intervention. Teletherapy platforms contain the same essential elements of originally efficiency-tested interventions, but with the additional advantages of having information more available, being easier to use, and are less expensive.
Teletherapy also has many disadvantages. Some of those include that you need access to the internet, continuous coaching and supervision to maintain the correct implementation of the therapy. Additional research is needed to determine reliable, valid, and affordable components. It is not a preferred option for clients with limited attention, and it also includes extra costs. Some of those costs can be seen through Capterra.com, where they said that the estimated cost of telemedicine software is to be anywhere around the software based for $1,500 per patient site and hardware based $10,000 per patient site. The cart case for hardware software $20,000 to $28,000. When you look at the internet connection they need, based on the popular internet service provider AT&T, business grade internet services with faster plans can be over $200 a month. Also, the therapists themselves need to have an extra licensure. This cost can add up, as a behavior analyst must be licensed in their state, county, and in the state and county that is providing the services. One of the issues is that teletherapy has an access to internet. Rural families across America do not always have access to reliable broadband connection to transmit data across the internet. An article published by Emergence, an online farmers business network, states that 39% of rural Americans lack broadband access. This image of a broadband access in the United States shows that areas that are without access. The image was part of a presentation in July of 2017 discussing the fact that there are many Americans without access to broadband due to living in rural areas. While families without access to broadband may try to utilize cell phones or satellite data packages, those are not always reliable and may not be available in the rural areas either. Without a reliable internet connection, teletherapy sessions would be ineffective. Gibson et al. Brought up that an internet interruption or lack of reliable connection can cause an entire session of therapy to be missed or lost. This loss can cause a delay of services and may set back therapy or cause the family to become disengaged from the treatment. Another issue is the cost and convenience of use. A study by Vismera et al. Stated that the participants could only access the teletherapy through a laptop or desktop computer, and that often the equipment needed for the sessions was expensive. Families of children in need of ABA therapy may not have access to the funds needed to purchase a camera or computer that would allow for these sessions to transmit clearly and send back clear feedback on the interactions. While technology advancements and costs are changing daily, the affordability is a major concern for many. Also, schedules for families may not permit them to be tied to a desktop, or would it be convenient to carry around a laptop at all times? These families may choose to use a tablet or a cell phone. Again, their location or ability to do so will be tied to the access to data connection in that area. And yet another issue for teletherapy can include family openness to technology and building or technology issues, according to Hilty et al. In that study, they found that families that were focused on the idea of going to a clinic, having that type of one-on-one time with a therapist, are going to be resistant and not work well with teletherapy because they're not used to or comfortable with receiving that kind of information over a internet connection. Some other issues with teletherapy would be continued parenting, coaching, and supervision. Teletherapy enlists the parents to conduct the one-on-one therapy with the client. To ensure consistent understanding and use of the treatments, continued coaching and supervision is needed. Teletherapy turns the parents into the individual conducting all the therapy with their child. Weiner and Ingersoll conducted a study that addressed parents' ability to learn the therapy techniques and implement the techniques needed to conduct teletherapy with the client. The researchers stated that the educational level of the parents within their study was not necessarily representative of many client families. This also maintained that there continued coaching for the parents and supervision of their implementation of the procedures. This may require additional sessions that the families find time-consuming, leading to disengagement of the families with the treatment. Another issue is additional research. There is a limited amount of research concerning the uses of teletherapy, the security of the data and the reliability of data, and the cost of teletherapy to parents and families, along with the effectiveness of the therapy itself. Additional research is needed in this area and is currently lacking. Another issue that could be found, another con for teletherapy, is that clients with limited attention would not be good candidates for teletherapy. As the communication of the teletherapy is done via computer or tablet-based system, it is much easier for a client with limited attention to simply turn away or walk away from the device. While a parent may be able to redirect them to the device, the client's ability to maintain the focus and attention is not conducive for this type of therapy. Some of the ethical concerns with teletherapy are that maintaining confidentiality code 2.06. HIPAA has strict guidelines concerning client-patient confidentiality and sharing of information. Even with safeguards for the malware protection and to guard against hackers, data can be breached. While all forms of therapy work to maintain confidentiality, even the best HIPAA-compliant software can be hacked. A concern expressed by Barkea et al. Involved the reality that therapy in these sessions is broadcast over a live feed, making it more vulnerable to unauthorized monitoring by individuals on the internet. Another ethical code, 2.11, that concerns records and data, again addresses the HIPAA compliance with software that does not always protect against the hacker and malware breaches. While the therapy and treatment is being conducted via teletherapy, the families or clients themselves are often recording data and sending it across the internet. This leaves it open to other people within the area seeing and being able to see the records or their data. It also, as part of the HIPAA compliance, applies to the storage of data and records. While they're purchasing and using HIPAA compliance protective software is a must, digital means of storing data is always at risk of a hacker or malware breach. Another concern comes from the families and clients that are compiling the records and the data. While it's permissible for clients to self-report the data or records, when it is transferred over the internet, it is again vulnerable to that unauthorized monitoring. And a final concern would be the media presentations and media-based services code 8.04, which requires electronic media disguises confidential information concerning clients. While clients and therapists can work hard to set passwords, protect confidentiality, and disguise the information concerning their patients, the reality of utilizing the internet and non-clinic environments leaves this information open to a greater possibility of a breach of confidentiality and identifying information. Clients that are engaging in teletherapy from a phone or a tablet in a public environment are at a risk of sharing this confidential information with unauthorized individuals in the same area.
At this point, we will switch to debating in-home therapy.
There are many advantages to in-home therapy, many of which are listed here. With having the behavior analyst in the home physically, it can be sure that the data and records are taken accurately. Additionally, if the therapy involves both the parents and the behavior analyst taking data, this provides the accountability of each observing and recording. In-home therapy also allows for parent involvement. According to Leaf and his colleagues, home-based therapy gives parents more opportunities for direct involvement with the intervention and observation of each session. There are times that ABA is often a controversial topic. As many of us are studying and wish to become BCBAs one day, we know that certified behavior analysts are guided by ethical principles to ensure effective intervention that is made of evidence-based procedures and is individualized for each client. Allowing for a home-based therapy lets the parents monitor the therapy and see what occurs throughout it. This not only gives peace to the parents who may be new to applied behavior analysis, but it also holds the behavior analyst even more accountable for their services. The benefit of completing in-home therapy in a natural setting to the individual permits them to learn daily living and self-help skills that would be easily generalized based on their familiar environments. Another advantage of completing therapy in-home with the behavior analyst present is that it is a cost-effective option. There would be no extra startup costs like technology fees. Additionally, within a home-based model, parents do not have to worry about the cost and time that it takes to set up a space with the ability of video or web camera to be in view for video streaming sessions. Lastly, Leaf and his colleagues also mentioned that a home-based assessment may yield great ecological validity in identifying real problems and physically looking around the environment to determine the antecedent. Additionally, it allows the behavior analyst to observe the patterns of behavior within the family. For example, a parent-child interaction may involve the parent accidentally reinforcing a problem behavior, and if the child was to leave the viewing area of the camera, the behavior analyst would miss it. One ethical code that is in compliance when using in-home therapy is responsibility. This explains responsibility to serve the client and their needs first. Having the behavior analyst there in person holds accountable the parents that the problem behavior is actually being altered and is truly a problem behavior. For example, some parents may observe a behavior that they find to be bothersome but is not harming the individual or anybody near them. Another ethical code in compliance is that a client will receive the most effective treatment available to them. This can include treatments that require a more experienced and trained behavior analyst and cannot be properly trained to parents through video call. For example, if a child has some self-injurious behaviors, a behavior analyst may be trained in safe holds, and parents could not effectively be trained on video conference calls. Additionally, having assessments often and consistently may be easier for a behavior analyst to do physically, so again, they can physically look around and see the environment. Integrity is a must when providing services as a behavior analyst, regardless of through technology or physically in person. However, integrity includes assuring that the behaviors that are being observed, altered, or redirected are truly a problematic behavior. Environmental conditions that could affect the outcome of implementation or further learning experiences can be better manipulated or altered when the behavior analyst is physically present in the home and can see the environment more thoroughly.
There are also many cons to in-home therapy. It can be more time-consuming, expensive, there are traveling limitations, and limited access to services in rural areas and generalization. In-home services can be more time-consuming. According to a study by Wacker et al., when delivering services in the home for 20 participants, it would have taken 1 hour of the parents' time and over 8 hours of the behavioral consultants to travel to the participant's home and conduct FAs, as opposed to an hour and a half of parents' time, 1 hour of consultant time, and 1.5 hours of the parents' assistance time. In-home therapy is also very expensive, ranging from $30 an hour to about $120 per hour. As stated before, in the study conducted by Wacker et al., where FAs were conducted via telehealth, the average weekly costs per participant would have been $335.09 compared to $57.95 per participant via telehealth. The cost of in-home services is significantly more. Travel time between homes takes away time that could be spent with clients. Many factors must be taken into consideration, such as distance between homes and traffic that the therapist might encounter. If a therapist is traveling 30 to 45 minutes to get to and from a client, that is over an hour that is lost to treat other clients. In some rural areas, there's a lack of BCBAs that are able to service the clients. This can be due to a lack of qualified individuals or the lack of time to travel to and from one area to another. In larger cities, there tends to be a saturation. In 2014, it was reported that certain states that had significant shortages. Wyoming was reported to have 4 BCBAs in the entire state, and Idaho had 9, while states such as California had 2,716 BCBAs. According to a study done by Leaf and colleagues, it was found that another disadvantage to in-home therapy is generalization. Although the setting is a great natural setting for generalization for things such as daily life skills, it may be difficult to generalize certain learning models to other settings for several reasons. With in-home therapy, typically one therapist sees the client, and sometimes it creates a difficult situation for the child to use those skills when in a different situation and with a different therapist or individual. Ethical concerns for in-home therapy include multiple relationships and conflict of interest. According to Compliance Code 1.06, the behavior analyst is required to avoid the potentially harmful effects of multiple relationships. There is more of a potential risk for multiple relationships and conflicts of interest when providing services to the client directly in person. When the client becomes more comfortable around the BCBA, they are more likely to engage in activities that constitute multiple relationships, such as asking for favors and gift giving. Another compliance code that is of concern is interrupting or discontinuing services. According to Compliance Code 2.15, the behavior analyst must avoid interruption or disruptions of services and act in the best interest of the client. In the event that a behavior analyst encounters unplanned interruptions, such as illnesses, maybe they're unavailable, or situations such as traffic or natural disasters, they may be unable to facilitate the continuation of services. And last is maintaining records, code 2.07. According to this code, the behavior analyst is required to maintain confidentiality of records that are under their control. Behavior analysts must ensure that they are appropriately storing records when traveling. In the event that a car is broken into or stolen, a breach of confidentiality could occur if documents are not properly and securely stored.
This concludes our debate, pros and cons. I'm going to go over some frequently asked questions. The first question, Does an ABA teletherapist still need to follow BCBA compliance codes? The answer to that is yes. In any form of therapy conducted by a behavior analyst, the behavior analyst must adhere to the compliance code. What is the biggest ethical concern related to teletherapy? After discussing with an ABA who practices teletherapy, she expressed that maintaining HIPAA compliance is a big concern for many telehealth companies. Number 3, is one therapy more effective for certain types of people than others? As mentioned in our debate, teletherapy might be more challenging for individuals with attention problems. Teletherapy may be more effective for people who have social anxieties. Which therapy is more effective depends solely on the client. Number 4, can teletherapy and in-home therapy be combined? Yes, some agencies provide direct services via RBT in person, while BCBA services are provided via telehealth. This means that clients can still receive in-home ABA therapy by trained staff and receive weekly or monthly feedback and supervision from a behavior analyst via telehealth, where the BCBA observes this session through a live video. To summarize our debate, here are some of the biggest points. For teletherapy, the pros: cost and time effective. Clients in rural areas can access services and the effective treatment. Cons for teletherapy: continuous monitoring is needed. It's hard for families without internet access or families with limited technology. And it's more difficult to maintain ethical compliance because of the technology footprint. For in-home therapy, the pros: immediate feedback in a natural setting, and parents and therapists work together to maintain the records. Cons for in-home therapy would be that it's time-consuming for family and therapists, it's expensive, and it's more difficult to maintain ethical compliance because of relationships formed with the families. We hope this debate was enlightening and educated you on 2 effective modes of ABA therapy. The next slides will show our references. Thank you for watching our debate.